when you look at available hours, you want to look at what do you work per week, how many weeks per year do you work? Okay, and that's how you get your available hours, and then you track that, and that's how you make sure that you're matching your hours to the volume of what it is in patient visits and in active patients. Yeah.
What was this is not related, that dentistry versus quadrant?
Oh, thank you. Thank you. I'm going back. You're a good girl. Okay, so the biggest jump, what I'm talking about is the biggest jump a practice makes is when they do longer appointments and more dentistry per appointment. Okay, so what I mean by that is instead of saying to a patient, you know what, we're going to do one tooth, I call it Crown of the Year Club. Right? Every after Christmas, Hanukkah, Chinese New Year, whatever it is you celebrate, till May, everyone's really happy because what started over again? Another insurance maximum, right? So we say to the patient, you know what you had done last time, you need another one now. So what it is, it's treatment planning in quadrants as opposed to teeth. And I'll tell you, the number 2 reason patients don't show up, the number 2 reason patients don't say yes to dentistry, it's time. Okay, it costs you an average of $8.50 per breakdown setup per room per patient. So when you look at your volume, okay, that's just an infection control, supplies, barriers, that's just to get the room set up and broke down. So if you think about it, I don't mean you all do the panky thing where you do one in the morning and one in the afternoon and you're doing full 25,000 full mouth condylar rehabs. That's not reality, okay? But I mean, you're doing more, you're offering the patient more dentistry per appointment, longer visits when it's appropriate based on their treatment plan. And they generally always choose to come less, to come in frequency less time. When they do more per appointment, not only do you have much more from the business side, much more profitability per appointment because you don't have as much cost, but it's really interesting when we analyzed what is the true just basic supply and labor costs of breaking down and setting up a room. So you can imagine a practice that sees a patient every 30 minutes. Not only is it chaos and you're all doing the 3 o'clock dental prayer because we just it's like busy, 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 right? You reduced your number of patients, you do longer visits per patient, and then they're engineered into your schedule in advance. That's what I meant by tooth to quadrant. And that's, you think about it, when a dentist is with a patient and they can do 2 or 3 teeth in a sitting, it's common sense, right? Or they do the 3 teeth individually, the profitability is twice as much when you do it all at once. Remember, because we're mixing, what are we balancing? The patient, the numbers, the ability to pay our overhead, all those different things. There are all these moving parts in the whack-a-mole game. So that's just the fastest growth. Also what it is, it's also the biggest jump a dentist takes in their dollar per hour with speed and skill, because we don't have to start everything from zero. We can just keep going with 1 or 2 teeth.